Okay, in this video I'm going to go over Toby's case review. I've highlighted some of the things that are important. And basically, Toby's a 20-year-old male that has chronic gastrointestinal issues, has been working with some functional medicine practitioners, has SIBO clearly diagnosed every time he's been tested for it, has been treated for SIBO, but has persistent symptoms. And he has constant bloating that then turns into brain fog that he's trying to figure out, and he's got significant improvements with having a SIBO management, but it's not 100%, doesn't get rid of symptoms, and it always returns. He's had some traumatic brain injuries, he had 4 concussions, and he's played football for 6 years, so there could be some brain-gut axis related issues. And there's also a history of Accutane, and Accutane is one of the medications that's been shown in some studies with certain populations of people to turn on intestinal autoimmunity. So there's a potential for some intestinal autoimmunity and destruction of the gut nerve plexus that may be playing a role in his chronic gastrointestinal symptoms and persistent patterns of SIBO. But anyways, if we look at Toby's case study, we can see his chief complaints: stomach discomfort like burning, tense pain, burping, difficult to pass, burps, bloating, brain fog, fatigue, cold hands and feet, irritability, overwhelmed with indecision. And we can see that he's taking low-dose naltrexone, Clomid, and Clomid's an off-label drug for men. In females, it's used for fertility issues, but in men, it's off-label. It's used to increase testosterone levels. EpiPens. And then if you look at the supplements he's on, male optimization. So it looks like some of the people he's been working with have been trying to work on his male hormones, testosterone, taking some minerals, reishi, theanine, vitamin D, and acetylcysteine, zinc. But at this point, not really much for the gastrointestinal tract. But if you look at his history and go through his case review, he's really done a lot of things for that. Okay, so then when we go through his entire health history, he starts with a history at 3 years old having eczema on his face and anaphylaxis reactions, first to nuts, then to strawberries. So we can see right from an early age he's got some hypersensitivities, and if you look through the rest of the case review, you'll see he's got lots of IgE reactions. So he definitely has an activated IgE immune response. And then at age 12, he plays football and has gotten multiple concussions. I think four total concussions. And those are the ones that were clear and obvious. Obviously, playing football all the way through middle school and high school, which is a 6-year period of time, you're going to get lots of head injuries and head trauma. So when you see a 28-year-old with chronic brain fog, gut issues, cold hands, cold feet, there's always the possibility that this could be a very clear brain-gut axis disorder. We're going to need to sit down and figure out the history a little bit more, but it's definitely something to think about here. And then you can see here during middle school, high school, like before all these things started taking rounds of antibiotics for acne, and then is also having OCD symptoms. So the OCD, can take place when the frontal lobe is not developing. So we don't know if we have some kind of frontal lobe delay and a gut issue that are there. Maybe it's not a brain-gut axis issue. Maybe there's 2 independent things happening. So those are all the things to think about. So he basically plays football all the way through high school, stops, goes to college, and then in college, in his senior year of high school, it seems like he starts to have some digestive symptoms. So something happens in this timeline in high school, whether it's the Accutane that was used for the medication that turned on gut intestinal autoimmunity, whether he does have some disruption in that brain-gut axis disorder, or he's got a hypersensitive IgE mast cell response to some degree that explains some of his symptoms. But during college, my stomach issues started to get progressively worse. I had a wide range of digestion issues and Symptoms, everything from extremely foul gas to diarrhea to extreme bloating, anxiety, fatigue, and depression. So the fatigue and depression make you worried about this gut-to-brain axis. But it could also be brain-to-gut axis, and this vicious cycle of both of them involved together when you read his history. So then when he was 21 years old, he saw an allergist, and he started to get basically some low-dose antigen therapy. 2014, went to see a gastroenterologist. They did an endoscopy and biopsy and told him there's nothing wrong except a minimal hiatal hernia. Then he started working with functional medicine practitioners, and when he was 23 years old, remember he's 28 now, when he's 23 years old, he started working with a functional medicine practitioner. They started giving him digestive enzymes and really working on an elimination diet, FODMAP diet, trying to kill off bugs, working with allergies, and they didn't really get much progression. Some improvements. You can see stop gluten. That seemed to help a lot. That's something that's very important. And then 2019, he had H. pylori show up on a GI map test. Was successfully treated with various nutraceuticals, and he also started to work with someone that started to do lots of brain treatments, which I assume it's like a functional neurology, functional medicine person, combination of those things. He had him do gagging and gargling reflexes here to kind of, I guess, stimulate that brain-gut axis pattern that we talk about and have taught in the Cross Institute Gut Brain course. And then 2020, tested positive, works with a new functional medicine practitioner. They also find SIBO. They also start to try to treat him. He then eventually ends up on a ketogenic diet. And during this time, he's working with these functional medicine practitioners. He's continuing his allergy, sublingual allergy treatments with the allergist. Not making that much of a difference, it seems like. And then he started a ketogenic diet. His energy levels were great at first, and then he started to really get tired and diagnosed with adrenal fatigue, which doesn't make any sense, but it's on his report. And then he increased his carb intake, and it really helped him. The practitioner he was working with also suggested a carnivore diet, but he never ended up doing that. So lately he's been very irritable, stays up past his bedtime, wakes up at least 3 times to pee during the middle of the night, often wakes up feeling tired even after a good night's sleep. And then if you look at the timeline of diagnoses that were given to him, 3 years age, he was diagnosed with anaphylaxis to nuts and strawberries and nuts. And then 2016 he had hyperhomocysteine levels. And then 2016 low vitamin D. 2016 mild polycythemia. That's not accurate from what I remember looking at the case review earlier. And then he's been diagnosed with H. pylori infection and SIBO and vitamin D, and then blastocystis hominis, which is parasite. He's worried about his gallbladder, maybe not getting enough fats that he can digest. And then if you go through, you can see the different protocols and the opinions of different people, and basically he seems to get some of his improvements going on a gluten-free diet, getting some management for his gut by following a FODMAP diet, taking numerous nutraceuticals for his gut. Those seem to be some of the big applications here. Then he tried gargling, gagging to help his brain-gut axis pattern, and so forth. And then supplements or treatments that have seemed to improve his health, his types and SIBO protocol, Candibactin, AR, BR, loratadine, along with FODMAP diet help reduce bloating, but other symptoms still persisted, and these symptoms apparently are all come back and are still there. L-theanine helps with sleep. So we got to figure out why he's got racing thoughts. So racing thoughts can happen if there's a brain injury and the frontal lobe isn't able to dampen that limbic system. And then you can go through the timeline, and it's more of the same. So it looks like he's been working with some really good functional medicine practitioners who've done a pretty good job with him, and there's something that's still missing in the case. Now, if you look at the brain health nutrition assessment form, he's got some brain endurance and focus and concentration issues, cold hands and feet, tips of the nose is cold. So poor circulation can definitely impact brain endurance. That could be part of the reason he's got it. Fatigue issues. Difficulty eating large meals in the morning. This could be a sign he's just not getting his parasympathetic activity working in the morning. Feels overwhelmed with ideas to manage. This could be too much frontal lobe tasks. He's got symptoms of frontal lobe impairment on the brain region localization form we'll get into. But here, feeling 14, section 14 here, feeling of knot in the stomach, feeling of being overwhelmed for no reason, feeling of guilt, but everyday decisions, inability to turn off the mind. These are all symptoms associated with GABA, but even more so, they're associated with basal ganglia, dampening the limbic system. So the frontal lobe is where you have focus, attention, concentration. The frontal lobe fires into the basal ganglia limbic loop, and then that can dampen restless mind and a mind that won't turn off and so forth. So when we look at these symptoms here with his ongoing overactive brain and nervousness and anxiety and can't turn his mind off, and we see clear symptoms of frontal lobe, we definitely have to suspect that there's a frontal lobe potential injury. At 28 years old, he's having these symptoms, and this frontal lobe injury may be firing up his or his frontal lobe injury may not be allowing his limbic system to be inhibited, so he's got this restless mind, and these may be a role in some of his chief complaints, and maybe even his gut symptoms and gut issue. So you can see here in section in the section associated with the frontal lobe and prefrontal dorsolateral area, these are all executive functions, and 3s mean they have the symptom 75% of the time. 4 means they have the symptom 100% of the time. You can see that there's 4s for planning and organizing, making decisions. He's got some really difficulty there. Difficulty initiating and finishing tasks. He's got a 3 there. Difficulty staying focused and concentrating for extended periods of time. He's got a 3 there. So these are all prefrontal symptoms that are there. Then when you look at the rest of the form, there's not that many symptoms. He's got a couple symptoms associated with the medial temporal lobe, like confusion about dates, passage of time, difficulty remembering names. Definitely want to do a Montreal Cognitive Assessment form. Make sure he doesn't have any types of mild cognitive impairments with some of those medial temporal lobe symptoms. And then the rest of the report looks very normal. No major symptoms with the cerebellum or basal ganglia or occipital lobe or parietal lobe, temporal lobe. They all seem to be healthy and free of any symptoms. And then we get down here to the basal ganglia indirect pathway. That's the pathway that dampens that limbic area, your emotional brain. Intense need to clear your throat. He puts right or contract a group of muscles. He puts some numbers here as a 2, and constant nervousness and restless mind as a 2. So I want to see if he's got any hyperkinetic movement disorders when we do an exam history with him. I want to see if he constantly has to clear his throat. I want to see if he's got any tics. If he constantly has to blink or has any kind of hyperkinetic movement disorder. That can let us know his basal ganglia indirect pathways and working. He has a history of OCD. That indicates there may be some dysfunction there. Maybe there's an underlying PANDAS pattern there that have to be evaluated. Those are all the things you're thinking about looking at that. Then also difficulty relaxing. And then chronic digestive complaints. So those are all under autonomic imbalances there. So he complains of ringing and sensation in his ear, tinnitus. So we need to find out more about that. And then this section here, or this form here, the metabolic assessment form, you can see just all ongoing digestive symptoms that are there. Everything from dysbiosis to not enough hydrochloric acid production or not enough healthy digestion of carbohydrates, fats, proteins. They all seem to be involved right there. Then you get a little bit of you get some symptoms associated with hypoglycemia, agitated, easily upset, nervous, irritability between meals. things like that. Is under high amounts of stress, wakes up tired after even 6 more hours of sleep, decreased libido, unexplained weight gain, some andropause symptoms that are there. And then we can get into the neurotransmitter testosterone form, and doesn't feel overwhelmed. And you should know Toby is married to Madison, and both of them are patients in my office. And when we opened up our office, we get overbooked for a while, and then once we have maybe a year and a half, 18 months of appointments scheduled, we'll open up our schedule book again for new patients. And Madison immediately responded. The first hour was open and got both Toby and herself in as new patients. So it's nice to see the couple, and both of them were actually also have to be managed for any type of fertility issues as well. Okay. Now, if we look at his GI panel done just 3 years ago, he definitely has patterns of dysbiosis. That's what you're seeing with his normal bacterial flora. You can see patterns of dysbiotic bacterial overgrowth on the panel here as well. It shows up with the amoeba fragilis, which is a parasite. He writes in blastocystis hominis, so I don't see that on this part of the report. Maybe it's on a different part of the report. But a couple parasites. Now, he's been, if you look at his history, he's been treated for parasites and has multiple antiparasitic compounds. So he could have some infections causing his gastrointestinal symptoms, but it seems like working with the functional medicine practitioners, they have treated that. We may need to run another panel, see if that's still persistent. And then if you look at his blood work, you can see that he's got lots of IgE environmental allergen reactions to dander, to olive tree, to oak, to elm. So very environmentally triggered IgE response. Then we look at the rest of his blood work, his glucose, his BUN, sodium, potassium, his electrolytes. Everything seems okay. His bilirubin total is 1.9. That's slightly elevated. There's people that have what's called Gilbert syndrome. It's just a genetic disorder where they don't clear bilirubin very effectively. It's not a big deal. It's not a risk factor for anything. Alk-Phos being low, that doesn't mean anything either. So these things may look totally abnormal, but they're not. And then if you look at Toby's celiac disease markers, everything looks okay there. If you look at the urinalysis, or if you look at the CBC, no patterns of anemia or any type of red blood cell disorder. White blood cell count is, within the normal reference range. And there's no major shifts of white blood cells that are totally abnormal. So nothing significant there. He gets an H. pylori breath test. In the past, let's look at the date. This is just recent, actually, January 2022. So January 2022, no signs of CBC white blood cell abnormalities. So this is just a few months ago, 3 or 4 months ago. Then we look at his hormone profile 2 years ago. Everything's pretty much within range. Cortisol in the morning, below range. So literally just low cortisol levels in the morning. Doesn't have a lot of things on the dried urine analysis to really explain his chief complaint symptoms. Then if you look at blood tests that was done back in 2020, thyroid panel TSH looks fine. T3 uptake is elevated and T4 is elevated. T3 uptake is going to be elevated when there's high estrogens. So he has a pattern of high estrogens in his history, and this must have been during that time period. Alk-Phos being low doesn't have any clinical indication. Here we see his homocysteine elevated, 13.2, so that has to come down. His total T3 is 72, so that's definitely low. And a lot of times when the thyroid gland is doing its job, TSH is normal, but there's lots of T3 uptake. You can't throw off the total T4, total T3 levels and cause some imbalances there. So we have to see if we need to get an updated thyroid panel and make sure his thyroid's okay at some part of the initial workup. And then when we look at his gliadin markers, these are from LabCorp. They're not going to be that sensitive, but they're all normal. He's been on a gluten-free diet for some time now, so you could have false negatives also. Total lipid panel, HDL, LDL, everything seems okay. Reverse T3 is okay. Methylmalonic acid levels are okay. Then they checked his particle markers. Everything seems to be within normal reference ranges. Vitamin D levels seem okay, appropriate. 125 and 25. Well, his 125 is okay. His 25 hydroxy is on the low end. It's 35. Definitely want that in the 50 range. So we also want to get an updated vitamin D test. Make sure that that's not as low as it is. We want that definitely in the 50 range or 50 or higher. Gets tested for the HLA typing for celiac disease. Doesn't have any of the celiac disease gene types, variants. Serum copper is fine. TPO measures get checked for thyroid autoimmunity. Those are normal. Lipoprotein A is less than 10. That's okay. Then if you look at GGT, LD, magnesium, phosphate, they're all okay. His iron markers, iron panel looks pretty good. Then we get another updated white blood cell CBC count. Everything is within normal reference ranges. Immune function is 5.0. That's pretty good. Measure of C-reactive protein levels. That's okay. Ferritin levels are okay. So there's acute phase reactants for acute severe inflammation are within normal limits. His fasting insulin level is 2.8, which means it doesn't have hyperinsulinemia, which is a good sign. Free T3 is within normal limits. Parathyroid hormones are within normal limits. Serum folate and B12 are within normal limits. Hemoglobin A1C is 5.0. So those are nothing really too significant with his blood work. It does rule out a lot of mechanisms associated with any kind of serious metabolic disease that may be causing his persistent symptoms. Then as we get into specialty tests, like his small intestinal bacterial overgrowth test, SIBO test, you can see high amounts of hydrogen, high amounts of methane, so he definitely has small intestinal bacterial overgrowth. And then if we look at his hormone levels here, these are his estradiol levels, estrone levels. Estradiol levels are within range. Estradiol levels are okay. Testosterone levels are okay. They check for some phagocytic phyllium. Those are all fine. Rickettasia. I mean, you wonder why sometimes people run tests. I don't know why these antibodies were checked. C-reactive protein's fine. And then they did Lyme disease screening. Really, these are all non-reactive, of course. BBCO, just people searching for things. Creatinine levels 2.21. That's just urinary creatinine levels just slightly elevated. Not a big concern here. Check for COVID antibodies. TSH levels now checked again. TSH is 1.74. His T3 uptake is high and T4 is high. And the Clomid he's taking could be throwing off all these numbers. So it doesn't seem like he's got Hashimoto's or an actual hypothyroid issue. But Clomid can absolutely disrupt T3 uptake. It doesn't just have to be estrogens. So when you look at his abnormal thyroid panels and the mechanisms that can cause these, this is most likely a drug thyroid metabolic interaction with Clomid. Let's see what else we got. Heavy metals. They're all with nothing significant there. H. pylori not detected. Homocysteine here is 9.4, which is down, which is what we want to see. From his previous test, it was up to 13 previously. Here you can see another breath test done 2001, so about a little bit over a year ago. And then methane levels are positive again, confirmed SIBO. Then a blood test done about a year ago. Bilirubin's high 1.3. This is genetic Gilbride syndrome. Some people just slowly metabolize bilirubin. There's no concerns with that. It's just gene uniquenesses. Wow, look at here. Immunoglobulin E is 436. So he's definitely having some IG allergy reactions. And if you noticed on his previous reports, he has a lot of reactions to airborne allergens and strawberries and nuts since his childhood. The rest of the CBC looks fine. He was tested for antibodies associated with irritable bowel syndrome. And these are within normal limits. It's another Dutch test. What do we see here? Estradiol levels are above the range. 4-hydroxyestrogen is above the range. E2 is high above the reference range. This is for 2021. July 2021. So estrogen levels in the urine test are above the reference range. 5-androstenediol is also above the reference range. It's not really clear just from the case review document whether he was on the Clomid when these hormone levels were being measured, but he definitely has a clear pattern that he was on it when those thyroid panels were done. That's really the only thing that can cause those shifts that we saw there. And then the rest of this is the dried urine test. And then here we go, the thyroid panel again, T3 uptake. Or again, this is most likely the Clomid that's causing that. And then also, like, why are you taking Clomid? That's important to figure out. Probably someone trying to treat his fertility issue with medication. Here's his third SIBO test, again positive. So he definitely has SIBO. His gut's not working. His TSH is normal. Against T3 uptake is the interaction with Clomid. Bilirubin here total is the normal reference ranges. These can fluctuate, but we know he's got Gilbreth. Alkphosphine level low doesn't mean much. Maybe associated with like zinc, if anything. C-reactive protein is a little bit high here, which we don't like. 4.2. Estradiol free levels are high. High estradiol, high C-reactive protein. Those for a male could be cardiovascular risk factors. Blood cells again seem okay. So those are the main things on his blood test. So overall, when you look at his blood tests, it just seems like he's got some thyroid interactions, disruptions by taking Clomid. He definitely has SIBO confirmed. He's got amoebic parasite that was diagnosed back in 2020. We may need to look at that. Overall, his white blood cells, red blood cells are okay. He doesn't have any signs of disease. He's had a history of some high ferritin, some high C-reactive protein, some underlying inflammatory responses there. So we definitely want to get some updated routine blood work, see where everything's at. We definitely want to go into the history and really figure out what kind of patterns may be causing his chief complaints. Now, his stomach is, if you look at his complaints of stomach discomfort, burning or tense pain, burning difficulty to pass or burp. Well, the bloating and stomach discomfort could all be from the small intestinal bacterial overgrowth. And usually when the gut's disrupted, you can't get brain fog, you can't get fatigue. So this could just be an ongoing cause of SIBO. Then we got to figure out why he's got ongoing SIBO. Was it accutane injury? Does he have intestinal autoimmune responses? Does he have brain-gut axis disorders from his concussions? Those are all possibility. The irritability, overwhelm, indecision, these can definitely be his whole frontal lobe limbic pathway that's not being dampened, most likely from his concussions he's had. So those all need to be evaluated when we get into the history and initial workup. Okay, I hope this was helpful, and thank you for your attention.